Hello and welcome to the first audio podcast of ZEF. ZEF is the Center for Development Research at Bonn University in Germany. In this podcast, we will talk about one of our major research initiatives, which is the One Health project. My name is Andreas Haller and our guest today is Dr. Timo Falkenberg, who coordinates the One Health project.
So, of course, today the issue of global health is very urgent with the COVID disease pandemic, and we will talk about this later. Maybe first you could explain this One Health approach for people who don't know much about it.
Yeah, sure. Thank you for having me, first of all, and I'm happy to contribute to this ZEF podcast. So, One Health. One Health has its origin originally in veterinary medicine, so it's coming from the animal side. And at the core of this concept is an understanding that there is in fact no dividing line between animals and humans. If we think about the pathology and the treatment of diseases in animals as well as humans, we notice that there is not much differences. And this is reflected also in terms of the development of new medicines and vaccines. As we know, these medicines and vaccines for human use are always first tested in animals because of their similarity. So based on this very basic principle of One Health, in the classical sense, One Health calls for the collaboration between human and veterinary medicine and its public health disciplines. More recently, and this is particularly in the aftermath of the influenza outbreaks that we experienced in the early 2000s, that it is necessary to also include the environment in this analysis. The environment is shared between humans and animals, and especially when we're looking at different environmental changes that basically we humans invoke due to our economic development, population growth, agricultural expansions, and so on, it influences and intensifies the interactions between humans and animals and therefore shape the health status of all species. So the One Health approach entails an holistic and integrated analysis at the interface between humans, animals, and the environment, with the ultimate goal to create the optimal health for all. So essentially, One Health calls for collaboration between the different sectors and disciplines, and this is not just including the medical disciplines, but also social science and environmental science, to understand the disease ecology from a holistic perspective and then develop interventions to reduce the health risk and promote health and well-being. So in a nutshell, One Health is an integrated interdisciplinary approach to analyze the interactions at the human-animal-environment interface.
Okay, so you talked about this interface between humans and animals, and in your article you wrote recently for the Uni Bonn series Lebenszeichen, Sign of Life. We put a link to this article in the description. There you talk about the transmission of diseases from animals to humans, these zoonotic spillovers, you call it. And this is, of course, in regard to the COVID pandemic, an important issue. We heard the stories about the transmission from bats to pangolins to humans, how this pathogen developed. How does this happen? How do these pathogens get from one species to another?
Yes, you're very much right. This interaction in terms of zoonotic diseases, this is the causal factor in some respect of the current emergence of the disease. I just take one step back just to emphasize again what zoonotic diseases actually are. So those are diseases that are transmitted between humans and animals, but they can also be transmitted in both directions, which is an important factor to keep in mind also. Very interestingly, the majority of diseases that we have experienced, tuberculosis, influenza, Ebola, Zika, BSE, to just name a few examples, are all zoonotic. So zoonotic diseases are in fact the most prevalent type of disease that we have experienced. So One Health, as it is classically concerned with human-animal interactions, obviously zoonotic diseases are a very important focus of the One Health community. But so how does this happen? Zoonotic spillovers involve a quite complicated process, but I'm going to try to explain it in a quite simple way how these spillovers occur. Most importantly, as an underlying process are genetic mutations of the pathogens. So in our current COVID-19 outbreak, it's a beta coronavirus. And such mutations of the virus then enable the pathogen to infect species other than the original host. But I don't want to get into these details of gene drift and mutations at this point, but focus the attention on how this spillover actually occurs, or better yet, what increases the risks of such spillover events. And the answer can be quite simple. It is the increased interaction between wildlife, domestic animals, and humans. So from a One Health perspective, we like to understand why are these interactions increasing, what are the factors that are underlying this increase, and where do these intensifications occur. So the underlying factors are quite numerous, but the most important ones are actually human population growth, which leads to the expansion of our human settlements, leads to the expansion of our agricultural production, the expansions of resource extractions. So essentially, we are converting natural areas into productive land uses. So through these processes, humans are essentially encroaching into wildlife habitats and are thus moving closer to the wildlife populations. At the same time, this habitat destruction and environmental degradation that comes along with these developments forces the wild animals to come closer to human settlements and agricultural areas, mostly in the search of food and shelter, and thus intensifying the contact between wildlife and livestock. So wherever such intensification of contact occurs, pathogens can be exchanged between species and are thus stimulating the genetic response from the pathogens, which then in turn can lead to the emergence of a zoonotic disease that is capable of human-to-human transmission. So the risk of zoonotic spillover events is linked to the density of humans as well as the density of animal populations. And wherever there's higher densities, the risk of zoonotic spillovers increased. So hotspots will always be places where we have high human density meeting high animal density, and this is further compounded when there is also a high variety of different species involved.
And this is exactly the case in these wet markets, as this wet market in Wuhan was the epicenter of this pandemic, probably. And now several international organizations are calling for a ban of these wet markets where wildlife is traded and processed. So how do you approach this suggestion to ban these markets from a One Health perspective?
Yes, it is very much clear that the wet markets are important hotspots of zoonotic disease emergence. And from this perspective, it is an obvious preventive intervention to simply ban these markets. So I can understand where this logic is coming from. But if we take a holistic One Health perspective, then I do have concerns that such bans could actually create the desired effect. So it is important to look at the effects of such bans beyond the direct impact on zoonotic disease risks. There is an entire industry attached to such wet markets. There's lots of people whose livelihoods are essentially dependent on wet markets. Whether they are involved in the procurement, in the hunting, the transport, the processing, or the sale, all these people have their sources of income derived from wet markets. So if we would simply ban these markets, we could induce poverty or even social unrest, which then of course will have negative consequences on health. Wet markets also form an important food source for the urban population. So if we ban them, we might create issues of food insecurity, particularly in regard to access. And I don't have to explain that, of course, access to food is a very important part of health. Lastly, there's also the issue of culture that needs to be considered. These markets are quite ancient. They are part of the culture of many Asian and African countries. So the question that I ask myself, if we ban these markets, would we eliminate the demand, or would the demand continue and as such move the markets onto the black market without any kind of regulation, which could then potentially aggravate the risk of zoonotic disease emergence? So from a One Health perspective, I would say to be cautious to call for simply banning wet markets, but instead try to find ways to regulate and monitor the wet markets in an effective way. How these regulations will actually look, I think for this we do need further research. It could involve banning individual animal species. It could involve creating regulations about the distance between animals. And it should also involve, of course, the monitoring of animals, similarly to what we see in the traditional or the mainstream livestock sector, with strict regulations in regard to hygiene to ensure sanitary conditions. How do we achieve this? I think transdisciplinary research is very much important, where we involve the different governmental sectors as well as the vendors and traders, and involve different academic disciplines to holistically understand the situation and then find effective policies that do not undermine the livelihoods of the people who are working on these wet markets.
So this is a good point, these regulations. And in your article, you wrote, I quote, "Health experts have been warning about the pandemic risk of zoonotic spillovers for years, highlighting the need for integrated surveillance systems at the human-animal interface. And especially at these markets, we have this situation. So this danger was well known for quite some time. Have these experts not been heard by public officials and policymakers, or didn't they react, or what's the cause of this?"
Well, I think this is a classical issue of knowledge transfer. Translating scientific findings into effective policies is a difficult task. And once again, I hear advertised transdisciplinary research approaches that involve policymakers throughout the entire research process. I think we require the involvement of policymakers in our research to ensure that the knowledge actually gets transferred into the policy sphere and then gets translated actually into effective policy actions. Have these concerns been heard? And I must say, yes. Zoonotic disease prevention has been prioritized by the WHO. The World Health Organization International Health Regulations that were published in 2005 obligates countries to create frameworks for the rapid detection of and response and control of infectious diseases, which is also including, of course, zoonotic diseases. In 2008, the WHO, along with the FAO and the World Organization for Animal Health, published the Tripartite Agreement, which is essentially a type of guide for countries to establish collaborations between animal and human health sectors to prevent and control zoonotic diseases. So countries have received some guidance, and many countries have also started to create measures, and some have even established One Health bodies or agencies at the national level to strengthen collaboration between the sectors. However, the implementation process has been quite slow, and there are many issues in establishing intersectoral collaborations, and then, of course, also developing and implementing integrated solutions. There might be power imbalances between the sectors. There is some interdisciplinary conflicts, of course, financial restrictions, human resource availability, time availability. All of these are slowing and sometimes even hindering the adoption of such integrated collaborative interventions. So I do think that policymakers and public service was aware of the zoonotic disease risk, but the process to concrete and effective action has been slow. So from a researcher side, it is important to recognize, again, the importance of knowledge transfer and adopt the principles of transdisciplinary research. That is, that science needs to identify challenges, problems, research questions essentially, together with policymakers and practitioners to generate implementation-oriented evidence. We need to support the policymakers with hard evidence to create effective policies.
Besides wet markets, you mentioned other forms of zoonotic transmissions or other locations where this could happen. You mentioned also the ecological side of it, like humans invading animal habitats, hunting, and all these practices. So there's also this social economic aspect, as you said, like people's livelihood depend on it. How are these issues, like the hunger and poverty that drives these practices, and the One Health approach to contain these zoonotic spillovers, how does this relate? Like the social, ecological aspect and the health aspect, how do you frame this broader problem?
Oh, yeah, you're touching here on a key ethical conflict that is, in my opinion, quite at the core of One Health. How do we value human life or human health vis-a-vis animal life or environmental health? And this question we have been discussing quite a lot in our graduate schools. So to what extent is One Health actually anthropocentric? And although it is claimed that One Health values all species, including the environment, equally, and it aims to achieve optimal health for all, we do notice that most available frameworks and indicators in the end do have a human focus. So let's just take the example of environmental health. How do we assess the healthy functioning of an ecosystem? Commonly, we look at ecosystem services, so supportive, regulating, productive, cultural services that the ecosystem essentially provides to us humans, provided that it is healthy. So we measure the health of the ecosystem by looking at the services it provides to us humans. Then an important challenge comes at the social ecological nexus when human behavior is jeopardizing the healthy functioning of the ecosystem, while at the same time this behavior is necessary for sustaining livelihoods. How can we balance this? And for this, in our graduate school, we follow systems approaches. They provide useful tools to understanding the dynamics at the socio-ecological system and helps to identify leverage points where the system can be altered without actually compromising the livelihoods. So this requires participatory research. There needs to be a deep engagement with the local community from the start of the project to the conceptualization and implementation of interventions. So how do we approach this socio-ecological nexus? Well, essentially, we look at it from an interdisciplinary, system-oriented perspective, and we're utilizing transdisciplinary, participatory, and implementation-oriented approaches. In the end, it is important to involve the people who are part of the system to understand the dynamics, what is actually driving the behavior, and what can we do to create alternatives to the harmful behavior.
Yeah, just to follow up on this, if you also consider these ecological and social issues, how does this relate One Health to other development policies or other development fields like economics and social science, natural science? And how does the implementation of such a holistic approach face these challenges and problems and contradictions? Like, there are different sides to the issue and you have to see how to get to your goal.
Well, firstly, I think if we fully embrace the One Health concept, then it becomes quite clear that it is connected in the way to all development policies. Health is very much dependent on social, economic, and also, of course, environmental factors. If we look at the well-established concept of the social determinants of health, then we see that things like economic stability, education, access to food, the social as well as the physical environment are all critical determinants of individual and population health. So at the same time, it is also quite well known that a healthy society is also a productive society. So improvements in health can also contribute to social and economic development. So there is a dual relationship between development policies and health. The link is, of course, highly complex and it's by no means an automatic mechanism. But if we put it simply, if we invest in health, we will induce benefits for development. So for this reason, I advocate the notion of health in all policies. Assessing the direct and indirect health consequences of any development policy is, in my opinion, necessary for sustainable development. And One Health forms an excellent concept to implement this notion. There are, of course, challenges. Challenges for realizing this effective integration is structural in the first instance. Our governmental systems across the globe are divided into sectors with clear hierarchies and a division of responsibility. And I already said before about named some of the challenges of intersectoral collaborations. And these also apply here. So we have the power imbalances, we have questions of distribution of funds, there is disciplinary language barriers, and so on. So increasing intersectoral collaboration needs to be furthered, and it has been prioritized in development policy for quite some time. I'm quite hopeful that we can overcome these challenges of intersectoral collaborations, but it does require a bit of work. One important factor is also political will. If there is strong commitment from the highest political level, the structural foundations can be built for effective intersectoral collaborations. A key challenge is always named as the financial resources. There is a high requirement for money to restructure a system and to build up new infrastructures. So this is in a way also a call towards the development donor community that the funding mechanisms need to be adapted so that interdisciplinary, participatory, intersectoral interventions can be implemented. And of course, these do require some additional funding and usually also require some additional time.
Yeah, so we talked about the possible measures on a quite abstract level. Maybe to get back to the current issue of the COVID pandemic, what could be concrete measures to prevent pandemics and these zoonotic spillover caused diseases in the future? What do you suggest?
Well, first of all, to prevent the pandemic, it is important for our global community, that means all countries, to work together and to openly share data. This, of course, requires, first of all, data must be available. There needs to be good and timely data. And this, in turn, is dependent upon effective surveillance systems. So my first recommendation would be to expand health surveillance across humans, animals, and the environment, and to seek ways to integrate these into an integrated health surveillance systems. So in order for such integration to work, there needs to be standardized data structures, there need to be standardized data collection methods, as well as data platforms that enable effective data sharing between governmental sectors as well as between different nations. Additionally, surveillance intensity needs to be amplified. And this is particularly important in low and middle income countries where currently the surveillance system is still rather weak. The most abundant wildlife species should be included in such an integrated surveillance systems, as these are the ones that pose the greatest potential threat of zoonotic spillovers. Also, the monitoring and modeling of environmental changes can be used to identify places where human-animal contact is likely to increase in the future, and then can thus provide us some insight where intensified surveillance activities are the most crucial. And this actually then brings me to my next point. It is not going to be possible to monitor everything. We cannot monitor every pathogen, every animal species, everywhere, in every country, at all times. So it is going to be necessary for us to identify places where we intensify monitoring. And for this, we can use a One Health approach, assessing the human-animal environment interface to understand disease dynamics, understand the disease ecology, to then identify the drivers and the hotspots of zoonotic spillover, to then prioritize the locations, the pathogens, the species where intense surveillance needs to be put in place and for which risk reduction strategies need to be developed. One starting point could be to establish mechanisms of traceability so that game or livestock animals can be traced from the hunting ground or stable to the market, so that in case of an outbreak, it can be linked to the place of origin and actions can be rapidly taken. So the market, of course, needs to be regulated and monitored. And this is, again, kind of touching on your previous question, rather than trying to ban these type of markets or the bushmeat trade, try to regulate and monitor these, I call them industries. What these regulations should be, this needs to be carefully assessed and researched, as I have mentioned previously. One interesting question for me, for example, is, why are people actually consuming bushmeat? Is it the main driving force behind this really the cultural preference? Or is it maybe linked more to the availability of affordable animal protein alternatives? So if we can understand the social economic dimensions behind certain practices, then only can we formulate effective regulations or even consider banning certain practices. Once a hotspot has been identified through such mechanisms, then we need to have a holistic assessment and based on this only make regulatory decisions. Lastly, I think we need to learn from our current pandemic. The experiences, the responses of our global community, as well as from the individual countries, needs to be comprehensively analyzed and evaluated, and then we need to draw our lessons learned. Outbreak response plans. I think this is one of the points that is most important. We need to develop pandemic or even endemic outbreak response plans. Now, when we're thinking about natural disasters, for example, every country has a natural disaster response plan. And similarly to this, we also need plans for zoonotic outbreaks. I think the current pandemic has shown us that the countries around the globe were ill prepared to deal with the pandemic outbreak. What measures are appropriate? What infrastructures need to be enhanced? What steps should we take? So we need to learn from this pandemic, from the actions that we have taken, create effective response plans so that in the future we are better prepared to deal with pandemics.
Okay, yeah, that sounds good. So just to wrap it up, so we need to analyze this human-animal environmental interface to trace zoonotic spillovers, then to increase surveillance, collect more data and share these data on a global level and develop these integrated surveillance systems. And we need regulations with the consideration of possible side effects, and we need better response concepts to pandemics to learn from this current crisis. So does this sums it up, or do you want to add something?
Yes, I think that pretty much sums it up. Just one last comment. It is important to differentiate between reducing the risk of zoonotic outbreaks, which might be confined to a specific region or a country, and a pandemic outbreak that involves the spread of disease across the entire globe. We should, of course, aim to prevent the zoonotic spillovers happening in the first place. And most of the points that we talked about today are focused on these zoonotic spillovers. However, once a spillover has occurred, it does not necessarily have to become a pandemic outbreak. That is where the rapid response and early actions are most crucial. So in our globalized world, where people, animals, and products move quickly and freely across the countries and continents, pathogens follow these movements and thus can also spread quickly. So for this reason, to prevent a pandemic, the most important is going to be early detection and then a consequent containment of the outbreak. And then we can avoid a zoonotic outbreak to turn into a pandemic.
Yeah, thank you. That was very illuminating.
Yeah, thank you very much. I'm very much looking forward to maybe doing this again sometime. I enjoyed it very much. Thank you.
So stay healthy.
Yes, you too.
Bye-bye.
Thanks. Bye-bye.